Endoscopic flushing with pronase improves the quantity and quality of gastric biopsy, a prospective study. Mucolytic agents such as pronase or N-acetylcysteine are known to improve mucosal visibility during EGD, during chromoendoscopy, narrow band imaging endoscopy, and endoscopic ultrasonography. In addition, pronase does not interfere with Helicobacter pylori identification using the rapid urease test or culture. Most of the previous studies used pronase as an oral pre-medication before EGD and found that pronase significantly improved endoscopic visualization and decreased the frequency of water flushing required during EGD. Recently, a study investigated whether endoscopic flushing with a bubble-bursting agent and a mucolytic agent is as effective in terms of improving endoscopic mucosal visibility as a pre-endoscopy drink of the same agents. Results showed that endoscopic spraying of these bubble-bursting and mucolytic agents was not able to offer equivalent improvements in endoscopic mucosal visibility when compared with the standard pre-endoscopy drink of these agents. There is no study on the effect of endoscopic flushing with pronase on the gastric biopsy specimen in terms of quality and quantity. The aim of the current study was to assess whether endoscopic flushing of pronase improves the quality and quantity of the gastric biopsy. The thickness of mucus covering the mucosa and the thickness of the biopsy specimen were also measured. Background and study aim. Pronase, a proteolytic enzyme, is known to improve mucosal visibility during esophago-gastroduodenoscopy, EGD, but little is known about its effects on gastric biopsy. This study assessed whether endoscopic flushing with pronase improves the quality of gastric biopsy. Patients and methods. Consecutive patients who underwent EGD were randomly assigned to either the control group or the pronase group in a prospective setting. The first biopsy of the identified lesion was performed during endoscopy. Endoscopic flushing with either 50 milliliter of water and dimethyl polysiloxane, DMPS, control group, or 50 milliliter of water, pronase, sodium bicarbonate, and DMPS, pronase group, was then applied to the lesion. After 5 minutes, the second biopsy was performed 2 to 3 millimeters away from the first biopsy site. After 5 minutes, the second biopsy was performed 2 to 3 millimeters away from the first biopsy site. The thickness of mucus, depth of the specimen, overall diagnostic adequacy, anatomical orientation, and crush artifact were measured to assess the quality of the biopsy. Results. Of the 208 patients, 10 were not analyzed due to the absence of an identifiable lesion. Compared with the control group, the pronase group showed significantly decreased thickness of mucus, P less than 0.001. Increased depth of biopsy, P less than 0.001. Improved anatomical orientation, P equals 0.010, and improved overall diagnostic assessment, P equals 0.011, in the second biopsy specimen following endoscopic flushing. The crush artifact and hemorrhage did not differ between the groups. Conclusions. Endoscopic flushing with pronase not only improved the depth of biopsy, but also the anatomical orientation and overall diagnostic adequacy. Pronase can be recommended for flushing during EGD to improve the quantity and quality of biopsy.